Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is radiofrequency ablation for back and neck pain treatment. Here's a few facts on back and neck pain. It affects 90% of Americans at some point in life. It's the second most common reason that people go to see a doctor, just behind the common cold. Leading cause of disability in those under the age of 45. And it's seen in up to 40% of those who undergo back surgery, which is called failed back surgery syndrome. With regards to neck pain, it affects about 10% of the population at any point in time, up to 45% each year. When you look at the cervical and lumbar facet joints, those are the joints of the spine. They're about the size of a thumbnail. They're on each side, all the way up and down. Okay? They have cartilage and they're prone to arthritis just like other joints, the hip or the knee. They are the cause of back pain 45% of the time, and we don't have a successful joint replacement for the facet joints like we do for the hip or the knee. When it comes to making the diagnosis of facet joint arthritis and syndrome pain, typically involves a history, a physical examination, x-rays, maybe a CAT scan, and oftentimes a diagnostic injection. Here you can see on the left a CAT scan, vertebral body, spinal canal. Here's the facet joints in the back, okay? They look nice, clear, open joint space, nothing ratty there. Whereas when you look at this one, look at all this arthritis. You can barely see the joint line here. Overgrowth of bone, these are called bone spurs. And interestingly enough, this person may have no pain, okay? But very significant arthritis. And at the end of the day, it becomes a coin toss. Severe pain may be accompanied with very little arthritis on imaging studies or vice versa. Even the best trained spine doctors, board certified, fellowship trained, get it wrong about half the time. That's what studies show. So modern medicine is not so great when it comes to the diagnosis of facet joint syndrome. So diagnostic injections can be very helpful. This one's called a medial branch block. If the pain doctor thinks that facet arthritis is causing pain, let's say at this level, L3, 4, then the doctor can inject numbing medicine around the joint, which numbs up these medial branches that provide sensation to the joint, and that can provide pain relief instantaneously if in fact that's the joint that's causing pain, okay? So that can help a lot with diagnosis. Also, the pain doctor can inject numbing medicine or maybe some steroid too right into the joint, okay? That's called a facet block or facet injection, and that can provide pain relief instantly and give the diagnosis. Now, if a diagnostic injection has a positive result, there's a little bit of a difference as to what exactly means a positive result. Some say 50%. Some studies show that 80% pain relief is more accurate. Some insurance companies require 80% pain relief on 2 separate injections before approving a radiofrequency ablation. So a medial branch block in and of itself may provide pain relief for 3 months on average. It serves as both a diagnostic and a therapeutic procedure. When the pain relief wears off, it can either be repeated or the person can move on to a radiofrequency ablation. Radiofrequency ablation has been a revolutionary procedure in pain management. It's also called radiofrequency neurotomy, medial branch neurotomy, medial branch thermocoagulation, radiofrequency denervation or lesioning, and then it can be shortened up to RFA, RF procedure. They all mean the same thing. Here's 5 facts about radiofrequency ablation. The current used is the same wavelength as radio signals, but it does not involve an FM radio, okay? It can actually be more painful afterwards temporarily before the pain relief really kicks in. Pain relief may last for upwards of 2 years. Studies show an average of 15 months. You do need to have the diagnostic injection prior so insurance can approve it, and it has been truly revolutionary because of the length of back or neck pain relief. What exactly is happening though? Okay, well here you see a facet joint, alright? This is a nerve root, so you're not doing anything to that, but these are the medial branches that come off of that nerve root. So basically these little nerve endings supply sensation to the joint, so if you don't have that sensation, you don't have the pain, okay? So any particular joint has medial branches supplying sensation from below, and there's also some coming down. Okay, see how this one comes down to supply this joint? So when you do a radiofrequency ablation, you're actually deadening those nerve endings. So you need to deaden them from the bottom and then the ones coming down. Okay. Now, for the radiofrequency procedure, patients are often given IV sedation along with numbing up the areas where the catheters are placed. So in the modern radiofrequency machines, you can actually treat several levels at one time. So at this point, you have 4 catheters placed for this procedure, and they're placed under fluoroscopy for accuracy. And the patient will be given an initial stimulation to make sure that it's not too close to an actual nerve root. If the leg or the arm jumps, then it is too close to a nerve root, and it needs to be pulled away before the procedure is performed. Now, this is what the machines look like. The radiofrequency procedure is usually 80 degrees Celsius for 90 seconds. That's not the way it is for all body parts, okay? That will deaden the medial branches. It's an outpatient procedure. It usually takes under an hour. What are the results? Well, patients can get pain relief for up to an amazing 2 years. It's significant and longer lasting pain relief compared to steroid injections. It allows patients a greater range of motion, decrease the use of pain medication, and a short recovery time. There are some potential complications. There's potential for increased pain for a week or so due to spasms. May have increased pain for months if the nerves are only partially coagulated, but that's less than 5% of the time. There may be some slight numbness of the skin over the procedure site. Very rare spinal cord trauma. The average pain relief in one study was over 15 months. And another study showed that when you have a repeat procedure, you can get the same results again. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.